And Bharat Kannad, the whole idea that she was projecting himself as the most efficient leader in the world, that Donald Trump was floundering, Prime Minister Modi had a pandemic situation on his watch which he wasn't being able to control. A lot of that narrative building or projection is now smashed to smithereens, and you in fact have a situation where she is not looking in control at all. All these bodies piling up which are flooding Chinese social media currently on TV. Many people there tell us that everyone around them, there have been moments like that in India as well, but everyone around them seems to be down with the flu at this moment. Testing isn't happening, so it could be COVID, maybe it's not, and she is looking and cutting a sorry figure.
Well, absolutely. I think it's his hubris, I think, that's been targeted and that's been torpedoed. He hasn't learned that the disease really doesn't follow the Chinese Communist Party diktat. And basically then what he'll end up doing is, as I mentioned before, isolating China, also because the fear of Chinese mutant, more dangerous mutant than we have seen, a mutation of the virus than we have seen earlier, or what countries like India have experienced, means that every country will be proactive in trying to restrict Chinese travel, in trying to reduce the interactions they have with Chinese personnel, government officials, etc. You're going to have a cascading effect, and it's really a turning back of the zero COVID policy that Xi Jinping practiced at home, turning on itself and in a sense isolating China. And that really means in larger terms that China becomes less central, not just to the global economy, but to international affairs generally. It's not imminent, but that may be the long-term effects if this sort of trend continues.
Dr. Guleria, is it important at this time to ban all flights in and out of China, at least coming into India, so that our people are safe and we don't let the virus in?
No, I don't think that now is the time to look at a ban on flights, because the disease is already there in our country. It was something useful when we did not have COVID in India. And secondly, we know that the world has now become small. There are people who travel from one place to the other and hop from one destination to the other. Therefore, it's going to be difficult to control the spread of infection if we ban flights from one area and allow it from the other, because people will travel from different hubs. And therefore, this measure will not work. Also, there are people who come in what we call the incubation period, or maybe asymptomatic, and may have come from a different part of the world. Therefore, currently it doesn't seem to be sort of worthwhile to really ban flights. We need to be vigilant and should encourage anyone who comes from outside and develops flu-like symptoms to come forward, get himself testing, and we must do genome sequencing so that if that is COVID positive, we are able to pick up any new variant which may have come from outside. But banning flights, I don't think, is a solution.
We've seen Health Minister Mansukh Mandavia writing to Rahul Gandhi saying that the Bharat Jodo Yatra should follow COVID guidelines, and many are wondering whether they should now tweak their New Year plans. They've got holidays planned, Christmas, then New Year's. Is there any particular precaution that should be taken? Should gatherings be avoided in this festive season?
So currently our situation is good. We are not seeing increased hospitalization or deaths. So I don't think that I would say that we should go back to what we were doing last year in terms of total ban in all these activities. But like I said, the high risk group, if possible, should avoid crowded places where chance of infection is high. And even if they go to these places, they should wear a mask, and hand washing should also be done. But a total ban on such activities, I don't think is warranted currently. We are not seeing that type of cases in our country. We need to be vigilant, we need to take precautions, but we don't need to have a panic situation.